Hello, my name is Erica Ludi. I'm a general surgery resident at Emory University, and I recently completed a 2-year research fellowship in Santa Cruz, Bolivia. This morning, I will be presenting my oral talk titled True Bolivia, Trauma Responders Unifying to Empower Communities in Santa Cruz, Bolivia, Participant Baseline Characteristics and Opinions. By way of introduction, more than half of all trauma deaths occur in the pre-hospital setting, with low and middle income countries shouldering the largest burden. Literature shows that coordinated pre-hospital network implementation, including first responder and ambulance driver skills trainings, can reduce mortality by as great as 20 to 30%. Preliminary research in Bolivia has demonstrated that local first responder courses have improved participant knowledge and confidence levels. The aim of the current study is to analyze participant baseline characteristics and post-workshop evaluations to inform future course promotion and development. Our course was formed from 2 precursors developed by Mamta Sarup, a trauma surgeon in Chicago, which were adapted and translated to make a course specific for Santa Cruz. It is a 4-hour course generally given over 2 days with a didactic and practical session. There is a pre-course demographic survey and a 9-question knowledge pre-test. There is also a post-test and a post-course evaluation. We worked with the State Department of Health, local universities, and the urban mobility sector of the municipal government to recruit participants. Quantitative data was aggregated in Microsoft Excel, and qualitative data was analyzed for thematic content. To go into a little more detail about the course itself, during the didactic session, we discussed incidents of trauma, prevention, scene and personal safety, transfers, airway, and bleeding control. Instruction is geared towards how to manage injured patients at the scene with minimal resources. The practical session is divided into 4 stations. The first station deals with how to transfer patients and what techniques can be used based on the injuries and the consciousness of the victims. The second is a station on basic airway management geared towards evaluation, performing a jaw thrust, and putting the patient into the recovery position. The third station is bleeding control. They practice direct pressure and wound packing with plastic bags or gloves for personal protection. We also teach them how to apply cloth and combat tourniquets. Lastly, we have a pelvic binder station where they learn how to log roll the victim, adjust the binder, and secure it. Now that you have a little context for the course, I will present the results of our pre- and post-course evaluations. Over a 14-month time frame, we provided 24 courses with almost 500 participants attending at least one session and 355 completing the entire course. The average age was 36 and 79% were male. 64% worked in transportation and 23% were students of medicine or nursing. 83% were high school or university educated. However, despite this high-level education, 64% reported they had never taken a first aid class before, and 55% did not own first aid equipment. When asked about their previous experience, 87% had witnessed a previous trauma, but only 45% had provided aid in those scenarios. The most frequent previous trauma identified was motor vehicle collisions. On post-course evaluation, we asked them to rate the content, the thematic content, and the audio-visual quality of the course on a 5-point Likert scale, which were both rated close to 4.6 on average. When directly asked about the benefits of the course, the didactic and practical knowledge gained and the confidence and capability to help others in the future, or a combination of the two, were identified as most beneficial of the course. A few example quotes are, one participant stated, to learn trauma first aid, and now I feel more capable and assured to be able to help when the situation presents itself. A second stated, to bring necessary help when it's required, no matter the place. The majority would recommend the course to their peers, and the overwhelming majority said they learned a new skill that they would use in the future, with bleeding control, airway management, transferring an injured patient, or a general comment or everything being mentioned as the most frequent benefits or new skills. The great majority of participants did not want to eliminate any content from the didactic or practical sessions. Nearly half of the participants wanted to add a theme to the didactic portion. The most common suggestions were CPR, burn injury management, and more advanced first aid courses. Almost 30% suggested adding a skill to the practical session, and this included CPR and Heimlich maneuvers for choking or more advanced airway management. As one of the main aims of the study was to inform future course promotion and development, we reported the data back to the municipal government after the research phase closed in January of this year, took the participant feedback into consideration, and introduced a partnership with the local urban rescue group. We now do the true didactic and practical sessions in 2 hours, and then we have 2 hours dedicated to CPR and choking management, as well as fire prevention and extinction. We have continued to stay in touch with our partners in the municipal government. While larger in-person meetings and classes remain canceled in Bolivia, we've started to discuss the possibility of hosting virtual classes and have even been able to offer them in Portuguese to students in Brazil. We've also started planning and developing a reporting and tracking tool for incidents, injuries, and aid provision that would involve an interactive WhatsApp bot for data collection and mapping. I just want to finish by thanking the institutions that made my fellowship possible, thanking my mentors, and acknowledging our local partners. I've included my contact information for any comments or questions. And thank you again to the Pan American Trauma Society for the opportunity to present.